Welcome back. While we continue through the pandemic, we can't forget about the other epidemic, and we're talking about the opioid epidemic. Joining us now to talk more about this, Medical Director at Rushford, Dr. J. Craig Allen. Thank you so much for being here with us today.
Thank you, Mackenzie.
As we look at the statistics regarding opioid deaths in Connecticut, has COVID-19 played a role?
It certainly has. The stress, the isolation, disruption of treatment services and recovery services, that's all played a role, including the toxicity of the drugs people are getting.
At Hartford HealthCare, you have taken extra steps when it comes to Suboxone training. What exactly is Suboxone for those who may not know, and how is it used for patients with opioid use disorder?
Well, that's a name brand, Suboxone. The active ingredients are buprenorphine mixed with naloxone, and this medication is used as a replacement for opioids. It stops the withdrawal symptoms, it stops the cravings, and studies have shown that it increases the chances of someone staying alive and not overdosing and dying by 50, 60, maybe even a higher percentage.
And like I just mentioned, you guys are taking extra steps to make sure your staff is properly trained on administering Suboxone. Can you talk a little bit about what exactly those steps are?
Right. We're doing a training next week, and it's open to all providers at Rushford. The more Rushford medical providers that understand opioid use disorder and understand first-line treatment, which is medication-assisted treatment, how to administer it, the better off we're all going to be, because this is a disorder where you want to meet someone where they're at, and when they're ready for treatment and they're in withdrawal, whether it's the emergency room or on one of the medical surgical floors, we want to be able to give them that medication and start them on their way so that they can get into recovery.
And one final question for people who may not know, what resources do you have available at Hartford HealthCare who may be struggling with addiction?
Yeah. We have a full continuum of services. We have outpatient services throughout the state, as well as residential services, detox management services, relapse prevention services. And we're doing this work virtually or in person. And when we do it in person, we do it in a safe way. You can contact us through the Compassionate Care line, 833-621-0600, and we'll get you hooked up with a service near where you live.
Perfect. And as always, we also have that website right there on your screen that you can also go to. Doctor, thank you so much for joining us today.
Thank you, Mackenzie.